You might be wondering what metoprolol is used for, when you should take it and not take it, and what are the side effects, and specifically, what can you do to help the side effects you get with beta blockers. This is especially important if you are already taking metoprolol or about to start taking it for the first time. In this video, I'm going to explain everything you need to know about metoprolol and answer these specific questions at the end of the video so you have a better understanding about this medication. So let's get started. What is metoprolol and how does it work? Metoprolol belongs to a group of medicines called beta blockers. Like other beta blockers, metoprolol works by changing the way your body responds to some nerve impulses, especially in the heart. It slows down your heart rate and makes it easier for your heart to pump blood around your body. Your blood vessels relax, which drops your blood pressure, and this helps lower your risk of future heart and blood vessel disease. So what is it used for? It's used to treat high blood pressure, treat conditions that cause an irregular heartbeat, help prevent future heart disease, heart attacks and strokes, help prevent chest pain caused by angina, help prevent migraines, helps to reduce anxiety. Also, it helps reduce your symptoms if you have too much thyroid hormone in your body. You'll usually take it together with other medicines to treat your symptoms. Metoprolol is only available on prescription and it comes as tablets. So what is the correct dose? The key to starting metoprolol is to start on a low dose and increase this slowly to the right dose for you. In the United Kingdom, metoprolol tablets come in strengths of 50 milligrams and 100 milligrams. How much you take depends on why you need it. For high blood pressure, 50 milligrams to 100 milligrams is usually taken twice a day. For chest pain, it's 50 milligrams to 100 milligrams taken 2 to 3 times a day. For an irregular heartbeat, it's 50 milligrams taken 2 to 3 times a day. For preventing migraines, it's 50 milligrams to 100 milligrams taken twice a day. For too much thyroid hormone, it's 50 milligrams taken 4 times a day. So how do you take it? You take metoprolol with or without food. Swallow the tablets whole with a drink of water. Some tablets have a score line to help you break them in half and make it easier to swallow. Your doctor may advise you to take your first dose before bedtime because it could make you feel dizzy. If you do not feel dizzy after the first dose, take metoprolol in the morning. If you have metoprolol more than once a day, try to space the doses evenly throughout the day. Metoprolol starts to work after about 2 hours, but it can take up to 1 week to take the full effect. Your healthcare provider will want to check your blood pressure and your heart rate usually after about 1 to 2 weeks after starting your medication. So can you drink alcohol? Drinking alcohol can increase the risk of side effects with metoprolol. It can make you feel dizzy or lightheaded. So it would be best to minimize how much alcohol you drink because alcohol will lower your blood pressure and it can make you more likely to faint. And it's best to stop drinking alcohol if you find that metoprolol does make you feel dizzy. So does metoprolol interfere with other medications? There are some medicines that may affect the way metoprolol works. Tell your doctor if you're taking other medicines for high blood pressure. The combination with metoprolol can sometimes lower your blood pressure too much, which may make you feel dizzy or faint. Tell your doctor if this keeps happening as they may change your dose. Other medicines that can lower your blood pressure and cause hypotension, these include some antidepressants, nitrates, baclofen, tamsulosin, and co-caroldopa and levodopa. Non-steroidal anti-inflammatory drugs such as ibuprofen. These are medicines that may increase your blood pressure, so it's best to keep them to a minimum. Cough medicines that contain pseudoephedrine or xylometazoline. Or medicines for diabetes. Metoprolol may make it more difficult to recognize the warning signs of low blood sugar. Medicines for allergies, such as ephedrine, noradrenaline, or adrenaline. Medicines for asthma or chronic obstructive pulmonary disease. Amiodarone, bupropion. So who can take metoprolol? Most adults can take metoprolol. It is used by all cardiologists because it's been around for a long time, and it really works quite well by slowing down the heartbeat and decreasing how hard the heart has to pump. So who may not be able to take metoprolol? Metoprolol is not suitable for everyone. To make sure it's safe for you, tell your doctor before starting metoprolol if you have ever had an allergic reaction to metoprolol or any other medicine, low blood pressure or a slow heart rate, lung disease or severe asthma, metabolic acidosis when there's too much acid in your blood, an overactive thyroid. Metoprolol may make it more difficult to recognize the warning signs of having too much thyroid hormone in your body. Severe blood circulation problems in your limbs, such as Raynaud's phenomena, which may make your fingers and toes tingle or turn blue or pale, or a liver condition. So what are the common side effects? Metoprolol can make some people feel dizzy or lightheaded, especially when they first start taking it or after taking a bigger dose. After standing, getting up more slowly may help if you begin to feel faint, and sit down for a few minutes until the feeling passes. If this happens to you, do not drive a car, ride a bike, or use tools or machinery. If you get a headache, drink plenty of water and ask your pharmacist to recommend a suitable painkiller. If the headaches continue, let your healthcare provider know. Tired or weakness can be so debilitating for some people, but may improve with a lower dose. Please speak with your healthcare provider about it, who can then review your medication. If you get cold hands and feet with tingling or numbness, try wearing some warm socks and gloves, especially in the colder weather. If there is no improvement, tell your healthcare provider. If you feel sick, are vomiting, or have abdominal pain, stick to simple foods and avoid rich or spicy meals. Trouble sleeping or getting strange dreams is very common. Speak with your healthcare provider if any of these symptoms become troublesome. Some people on metoprolol say that their sex drive goes down or they cannot get an erection. Erectile dysfunction happens quite often with beta blockers. I would advise that you speak with your healthcare provider, as they may want to switch medications to something that does not cause this. So what are the serious side effects? I would call a doctor or emergency services straight away if you get shortness of breath, wheezing, and tightening of the chest. These can be signs of lung problems. If you get shortness of breath with a cough that gets worse when you exercise, like walking up the stairs, swollen ankles or legs, or an irregular heartbeat, these are signs of heart problems. If you get a low mood, in my opinion, this is a serious side effect, and please talk with your doctor about this, as metoprolol can affect your mental health and your doctor might want to switch your medication. If you have a fast heart rate, high temperature, trembling and confusion, these are signs of too much thyroid hormone in the blood. If the whites of your eyes turn yellow or your skin turns yellow, these can be signs of liver problems. You get unexplained bruising or you bruise more easily than usual. These can be signs of low numbers of platelets in your blood. If you have heavy bleeding or bleeding you cannot stop, such as cuts or nosebleeds that do not stop within 10 minutes. If you have chest pain that does not stop after a few minutes, or is new or worse, or if you already have angina, chest pain is a possible sign of a heart attack and needs to be checked out as soon as possible. And finally, if you have a serious allergic reaction. Now remember, these are not all the side effects of metoprolol. For a full list, see the leaflet inside your medicine packet. Now, a common question from patients is that they are having side effects from metoprolol, and what should they do? This really depends on what your condition you're taking your metoprolol for, but in quite a few cases your doctor might, number one, switch you from metoprolol to another more specific type of beta blocker like bisoprolol, and this may be enough to help your symptoms. Number two, they may reduce the dose you are taking currently. Or number three, they may switch you to another blood pressure pill, entirely different, such as an angiotensin converting enzyme inhibitor like ramipril or lisinopril, or an angiotensin receptor blocker like candesartan, irbesartan or losartan, or a calcium channel blocker like amlodipine, or a diuretic that are tablets that make you pee more like furosemide. The bottom line is that there are lots of options, so don't feel trapped and miserable taking metoprolol. Speak with your doctor about what's happening so they can better help manage your symptoms. So what are the lifestyle changes you can make to help the health of your heart? You can boost the health of your heart by making key changes such as quitting smoking. Smoking increases your heart rate and blood pressure. Giving up smoking brings down your blood pressure and relieves the heart failure symptoms. Try to avoid secondhand smoke as well. Cut down on alcohol. Drinking too much alcohol raises blood pressure over time. It makes heart failure worse too. Try to keep to the recommended guidelines of no more than 14 units of alcohol a week. Exercise, regular exercise, lowers blood pressure by keeping your heart and blood vessels in good condition. It does not need to be too energetic. Walking every day will help. And eat well. Eating a healthy, balanced diet can help if you have high blood pressure or a heart problem. Correct your balance of sodium and potassium intake. Help manage your stress. When you're anxious or upset, your heart beats faster, you breathe more heavily, and your blood pressure often goes up. Find ways to reduce stress in your life. To give your heart a rest, try napping or putting your feet up when possible. Spend time with friends and family to be social and help to avoid stress. Get better sleep. Try breathing techniques, breathing through your nose rather than your mouth. And finally, supplementation with micronutrients. Now please give this video a like if you enjoyed it, and make sure you hit the subscribe button and hit the bell to get notified every time I post a new video. Please let me know in the comments what you enjoyed about this video or what you'd like to learn more about. And feel free to check out some of my other videos on blood pressure medication. Thank you for watching, and I'll see you again soon.